Hi everyone, my name is Dr. Gideon Kwok, and I am here with AI Wellness Education. We are here to create education that is going to be vetted, that's going to be curated. We're going to bring you up-to-date things that really are going to make an impact in your life. And we have an amazing guest here who is, I think, going to change up a lot of what we were taught in medical school and what we push out to the public as far as preventative things that we do for ourselves. So we have Dr. Jennifer Simmons here with
Hi.
amazing new technology insights, and we're going to dive deep into this. So tell us, I guess, what's your background and who are you?
Yeah, who am I? What an existential question.
Right?
So I started off my career as a breast cancer surgeon.
Wow.
And
Okay.
I spent 17 years as a breast cancer surgeon. And at the top of my game, I got my own diagnosis.
Oh,
And
wow.
so, yeah,
It's kind of a slap in the face,
yeah. Well,
in a
you know,
sense.
in some ways, I always expected it. I come from a breast cancer family, and really, as a traditionally trained physician, that's the way we're trained to think that these things are inevitable.
Yep.
And so when I got my diagnosis, I just thought it was inevitable. But something about me wasn't willing to accept the standard of care. Even though I was head of my department, even though I was running the cancer program for my hospital, there was a voice inside of me saying there's something more, and that I needed to pursue that something more. So I refused treatment.
Amazing.
And my doctor, of course, said to me the very words that I said to my patients over and over and over again, which is when they ask me, what's going to happen if I don't treat this? I would tell them, I think you're going to die of your disease. And that's exactly what my doctor told me. And despite that, I said, I hear you. I respect what you say. I respect your opinion, but that I really think that there's something more, something I need to pursue.
Amazing.
And I first learned about nutrition and diet because really as a traditionally trained doctor, we get none of it.
Zero.
15 hours in our first year of medical school and then never again.
Yep.
And I have 11 years worth of education because I'm a board certified surgeon, I'm fellowship trained, like I had a lot of education.
Yes.
So 15 hours in our first year, never again. And so I decided that was the place that I needed to start. And so I went to a talk, and a man named Mark Hyman walks on the stage.
Okay. We all know.
And now, bear in mind, this is 2016.
Okay.
So that name did not mean anything to me, and I'm deeply steeped in that conventional medical world.
Of course.
So he walks on the stage and introduces himself as a functional medicine physician, and all I can think of is, there's no such thing as a functional medicine physician. What is this quack talking about? And then I remember that I'm sick, and I'm there for a reason, and I check my ego at the door, and I sit down and I listen, and thank God I did. Because
Food is medicine.
Yes. And within 2 minutes of him speaking, I understand exactly why I got sick. I got sick so that I could be in that room on that day, in that seat, listening to him speak. Because what he was saying was telegraphing the rest of my life. That not only was this the key to my healing, but it was the key to my healing others.
Yep.
And it's only when we look at life through that functional medicine lens that we can truly heal ourselves and others.
Yeah.
Because as you very well know, health doesn't happen in a doctor's office. And it doesn't happen in a hospital.
Nope.
And it doesn't happen in a chemotherapy suite or a radiation suite.
Nope.
Health happens at home.
Yep.
And it took that event to open my eyes to all of this. And so, fast forward 9 years later, I'm a different person and
Still here.
still here, still alive and well.
Still alive and well.
And beyond that, I've completely transformed who I am, my practice, and my mission.
Amazing.
Because when we're in that conventional medical space, what are we focused on? Disease.
Yes.
That's all we're focused on.
Disease and patching it up.
Yeah. And and not even patching it up. I mean, we're suppressing symptoms for sure, but I don't know that we're doing any repairs,
Oh no, there's
right?
no repairs. It's
And so for me, the whole kind of mindset shift that came along with that was that what we focus on grows. So if I focus on disease, that's all I'm ever going to get.
mm,
But if you instead focus on wellness
yes,
and building health, that's what you're going to get.
exactly.
And that's what I wanted for me, and that's what I want for everyone else.
Amazing. That's what it really should be about. I think we, as the medical society, push onto people. There's that magic pill. Here's this. You're taking care of my health instead of actually patients going. You know what? It's my health. I need to take care
Yes.
of it. I'll get guidance from
Yes.
you,
Yes.
and let's do this on together. And
100%.
I
We need to
think
give people back their agency,
yes,
and they need to want to take it, which is, the interesting thing. And actually, like the day I left clinical conventional medicine
yeah,
was because I had a 19-year-old come into my office, and I had already completed all of my functional medicine training. I had a 19-year-old come into my office, and she was wheeled in by her mother because at 19, she had such advanced, progressive, primary, multiple sclerosis that she could no longer walk the 30 feet from the elevator to my office. Okay, that's where she was. And I had just listened to Terry Walls speak. Do you know Terry Walls?
no,
She wrote the Walls Protocol. She's a Midwestern physician who went from a zero gravity wheelchair because her MS was so progressed and she couldn't even support her own body weight to biking 20 miles a day within 6 months because she changed her diet and her lifestyle. So she wrote the book on this protocol. I had just heard her speak. I was like a kid in a candy store, so excited
right?
to share what I had learned with this woman and telling the story. And I'm animated and I'm excited, and you can
Right.
change this and you can change your life.
Right.
And she put her hand up in my face and said, "Doc, are you going to do my biopsy or not?" And it was at that moment that I realized that not everyone wants to help themselves.
Ooh,
A lot of people don't want to help themselves. A lot of people just want the pill, want the procedure, want whatever you're going to give and make you responsible for the health,
yes.
not them.
Oh, that
Right?
happens everywhere in life.
Yeah.
That's the blame game.
Blame
That's
game.
our society.
Yes.
It's the blame game. It's not my fault. It's your fault.
Right.
And I think doctors feed into that, and we as the medical society need to stop that and say, you need to take care of your health.
Yeah.
You are the one that can make those differences.
Yeah.
So what are you making a difference on? Because
Yeah.
I hear you are playing around with some amazing new technologies now.
I am. So, I always start off by saying that we have done a lot of harm, and we all took an oath, and I am as guilty as anyone else because I did this for a very long time. But we took an oath to say, first, do no harm.
Yep, exactly.
And all through my training, and my training got more and more geared to the breast cancer world as I progressed through my education. And all through my training, I was taught that mammograms save lives.
Yes.
And I never questioned it.
All doctors, all
Right?
practitioners are taught that.
And then about, I would say 2012, 2013, we transitioned from the 2D mammogram to the 3D mammogram, which is actually more like a CAT scan than it is like a mammogram.
Okay.
Because a mammogram was just a single radiographic image.
Right.
But tomography are tiny 3-millimeter slices that they then put together and create a 3D reconstruction. So it's anywhere from 2 to 3 times more radiation, right?
Yes.
Now, it's being used all across the United States, right?
Yep.
Did you know that that is not FDA approved?
No.
That technology was grandfathered in.
What? I had no idea.
Yeah, it was grandfathered in. And so here we are, imaging people with more frequency, using 2 to 3 times the radiation, and because it's more sensitive, the callback rate goes up, which means that more women get called back for more studies. So now we're talking about exponential
Radiation.
more radiation over a
Wow.
woman's lifetime.
And just
And
focused.
no one's, and you know, the radiologist will say, oh, it's the same amount of radiation that you get on a plane ride. Really? Well, it's not. It's now concentrated in
Right.
on the breast
Exactly.
while they're being compressed,
Exactly.
while they're being crushed to a fraction of their size.
Yeah.
So
It's not the same.
it's not the same. It's a 3-year-old knows it's not the same,
Yes.
right? But we've been duped. We've been told that mammograms save lives. So let's talk about that.
Yeah.
Do they save lives? Well, in every 10,000 women that you screen, one woman's life will be saved, maybe, and you will cause 7 breast cancers in that same population.
Wow.
Now, I don't really think that we are doing the right thing
No.
if we are causing more cancers than lives that we save.
Of course.
But, you know, there's someone benefiting from this.
Always.
Yeah.
It's always.
And so, you know, I'm really trying to just get the truth about mammograms out there.
Right.
But it was very difficult for me to do that before because I didn't have a solution. And now
You do.
I have a solution.
We have a solution.
Yes. So about 13 years ago, the NIH went to a gentleman named John Clark, and he gave him $20 million to solve a legitimate problem. MRI was thought to be the solution to mammogram,
Okay.
but MRIs are very expensive.
Very large.
They're not readily available,
Mm-hmm.
right? Especially internationally, they're not readily available. So you could never roll this out as a screening modality. So they give him this grant, and he solves the problem. And he solves the problem too well.
Yeah.
Because what was meant to only replace MRI is now poised to replace it all.
Wow.
So what this imaging entails, it uses sound waves, 360-degree circumferential sound waves
Okay.
that are transmitted through an ionic water bath, an ionized water bath.
Okay.
And it is creating a 3-dimensional image of the breast that has 40 times the resolution of MRI. So without radiation, without compression, without pain, a perfectly comfortable procedure that, depending on the size of the breast, takes anywhere from 4 to 15 minutes to image.
Wow.
It's major.
That is major.
Mhm.
And
Yeah.
probably costs way less.
Costs way less, which is
Which is
also
what
part of the
screening-
problem. Because while it makes a lot of sense to you and I,
Right?
the makers of the MRI machines,
We'll fight.
the makers of the mammogram
We'll
machines,
fight.
and even the insurers, because for me, it was a no-brainer for the insurance. Like, why wouldn't they want a technology
Get kickbacks.
that is less expensive? And the truth is that if the screening technology is less expensive and the diagnostic technology is less expensive, because instead of 4 tests, you get it in one,
Mm-hmm.
it replaces the screening mammogram, the diagnostic mammogram, the ultrasound, and the MRI.
Mm-hmm.
So if the insurers don't have to pay for that, they can't charge as much premium to their clients.
Mm-hmm.
And so around and around and around we go, and we have completely lost sight of what is right for the patients.
Oh, I know. We've lost control of the people who want to do good have lost control of how to do good.
Yeah.
Because if you look at medicine today, it's algorithmic.
Yeah.
I mean, as family doc, we will get dinged if we don't follow an algorithm on how to
Which
treat.
has nothing to do with patient care.
Nothing to do with
incidentally.
patient care.
Yeah. Like the best doctors now are box checkers.
Oh yeah.
They check
Exactly.
all the boxes.
They check all the
Has
boxes.
nothing to do with outcomes, has nothing to do with quality, has nothing to do with the patient experience.
Nothing
It's
whatsoever.
all about checking boxes. And it's horrible because the truth is that I don't think anyone goes into medicine anymore with anything but good intentions.
No, especially this day and age.
Yeah.
It's
There would be no other reason. But you get into the system and the system is so broken.
it messes you up.
Yeah.
And you get lost.
And so many of these kids, they get into the system and now they're $250,000 in debt
So
because of medical school and they're stuck.
they do what
They're
the system
stuck and
tells
they
them.
don't know how to get out.
Yep.
And you really can't be a critical thinker inside of the system.
They don't give you enough time.
Besides, they don't give you any time. They don't give you the freedom.
Oh.
In that, if you are outside of the box, you're someone like me, and now you're called a quack.
Yes. You were called a quack.
Right? So actually, that's how I knew I arrived.
That's amazing.
Yeah. So now when people call me a quack, I'm
You're like, thank you.
I have arrived. Because if I'm a quack and Mark Hyman's a quack, I'll take it.
Right?
All day long.
Completely agree
Right?
with you. Completely agree with you.
Yeah.
So access to this technology, what's
Yeah.
going on there
Yeah.
for the horizon for people that are intrigued about this?
Yeah. So there are 3 centers open in California right now. This is where the clinical trials were done. This is how they got FDA approval.
Okay, so there is FDA approval with this
Yes.
now.
Yes.
Amazing.
So it has FDA approval as a breakthrough device. And it has FDA approval to screen the population that needs it most, the women with dense breast.
Wow.
So, and that's the first FDA approval that's been given for breast imaging in 50 years.
Wow. This is
50 years since the
revolutionary.
original technology was approved.
Amazing.
Amazing. Amazing.
Well, we look forward to hearing more from you and
Yeah.
what amazing things that you're going to be continuing to educate and teach us about.
Yeah.
So thank you so
It's
much for
my
coming
pleasure.
on.
Thank you
Very
for having me. It's
awesome.
wonderful.
Thank you.